We have been doing a lot of work in the mental health space, and that work has been spearheaded by one of our team members, Kenya Kirkman, and she has worked with a lot of people here. And so at this time, I would like Kenya to come up. She's a senior program coordinator at the Arthur Ashe Institute, and I'd like you to welcome Kenya as she comes and talks about her work and the work that we have done together.
Good morning, everyone. Thank you all for being here. It's a pleasure to see you all, so many familiar faces. But before I begin, I do want to bring up one of our peer alum. I'm going to be talking extensively about our peer leadership program. But before we begin, we would like to start with a poem from Joanna Blake.
Hello, my name is Joanna Blake, and I wrote a poem called Selfless. You take care of everyone around you, checking blood pressures and temperatures too, but who stops to care for you? Who tends for your emotional and mental needs? Do you make time for yourself the way you pour time into others? Do you bandage the quiet wounds that bleed, or do you pretend like they don't bother you? You hold on, fearless, pushing through the worst, but every story has its lesson. And soon you'll see you cannot save everyone if you refuse to save yourself first.
Thank you, Joanna. And I remember when she came to the program last year, she shared that she was a poet, and that was her offering, and she was very shy. And fast forward to now, every time we call her and ask her if she's willing to give us an offering, she does. So thank you, Joanna. So I'm here to tell you a little bit about our Beyond the Stigma, essentially our portfolio. Just to give a little bit of context, we started this program 5 years ago at the height of the pandemic. And so 2020, it might seem like it was a long time from now, but the last 5 years, we've been really in the community with young people, adults, a lot of our partners. And so the work started with the support from UNICEF USA. It was the first time that they'd done an initiative or a program in the US. And we really just started off to have a collective conversation about mental health, how it was impacting young people specifically. We started with an extensive needs assessment, and so we had key informant interviews with educators, faith-based leaders, teachers, parents. And then from that, we recognized that we were going to design anything for young people, we had to also involve them in the conversations. And so we set out after our key informant interviews, and we had listening sessions. In those listening sessions, we had ages 12 all the way up to 24, actually, really engage with us and kind of share their knowledge, their perceptions around mental health, what were some of the barriers that they were facing, what were some existing supports that they knew about or they did not know about. And in those listening sessions, we really learned from them that a lot of them said if they were going through anything challenging, they were 9 times out of 10 go to their friends. There were a few who shared that they would, go to a loved one, a parent, or a sibling, but there was a vast majority that shared they would go to their friends. And so we recognized that if young people are going to each other when they're having challenges, they might not have the language, and so we needed to equip them. We also heard a lot about, unfortunately, there were young people experiencing friends who have either attempted suicide or unfortunately was successful. And so we also recognized that we had to equip young people with resources that, because they're young and that they might not be able to cope with and mediate. And so from that, we designed the Beyond the Stigma program into 2 pillars. It was our peer leadership program as well as our community education workshop. And a lot of this work would not have been possible without our strategic partnerships. And so we partnered with barbershops and salons, which for a lot of people who are familiar with the Institute, we have a long-standing partnership with barbershops and salons, specifically in Central Brooklyn. We partner with faith-based institutions, as I mentioned, with that needs assessment, as well as when we developed the actual program. We went into housing developments. We worked with senior centers, community-based organizations. The first year, in 2021, we worked with a lot of CBOs to kind of get young people to be a part of our program. And so it was really, really heavy that we relied on their support. After-school programs, middle schools as well as colleges. So in the last 5 years, we've had over 50 total partnerships, and we have engaged 20 new partnerships outside of those that we were already familiar with. As Dr. Frazier mentioned earlier, we also incorporated a lot of our mental health work into our other programs, so our cardiovascular work, our HIV work, even maternal health and things like that. So it was a lot of partnerships in the last 5 years to really make sure that we heard what the people were experiencing in the community, and recognizing that also, young people are not in silos, and so we had to also equip their parents, educators, their grandparents, and you name it. And so our program has been extensive in the last 5 years, and we've done them in different spaces. With our community education workshops, that was really tailored to individuals 18 and over. We also coined something called a pay and heal. Some of you will actually get to experience that today. We also had supportive spaces, because we also heard from the community about how accessibility, they wanted to attend our workshops, but either work, school, and so we set up a supportive space that was virtual. We attended tabling events. We also partnered with, again, going back to our strategic partnerships, we also partnered with Lyft, or City Bike, for those who are familiar. And we had these community mental health wellness bikes to kind of address two issues. One, transportation deserts, especially in areas like Brownsville, Canarsie. We also had some bike rides in Bedford-Stuyvesant as well. And then we also had our annual mental health symposium. And so in the last 5 years, again, just starting from what is some of the needs that young people need, what are some of the needs of our community, and how do we address that, and what is the best ways that we can meet people where they're at. And so recognizing that we had somewhat of a duty to them to kind of meet people where they're at, we did our programming in these spaces. And so to date, we have had 60 plus events. I'm really, really proud of a lot of the work that we've done. Specifically with our youth program, from where Joanna is from, a little bit about that. When we first started, it was about a 2-week program, and a lot of the young people shared that that wasn't enough time. And so today it is now 6 weeks, but essentially we work with high school students over the summers predominantly. And we engage them in conversations about what is impacting their mental health, again, what is their knowledge, perceptions, what are some barriers to getting support, what are some known resources that they know about. And in the end of the 6 weeks, they are tasked with actually developing their own workshop to go out into the community and share with other young people. And so some of the topics that young people have said that were really important to them as it pertains to mental health has been violence and mental health, social media and their mental health. This past summer, there was a workshop around body dysmorphia and just like body imaging, and how that impacts their mental health. So really using topics that they feel are important and how they address those messages. So to date, in the last 5 years, we have trained 67 peer leaders, and we have engaged over 800 youth. Another highlight in our youth programming is that as of 2023, we started to have a youth summit here at Downstate, again, trying to really access more young people outside of our peer program and how we can engage them. Each year, the summit is themed around something different, and so our first year was really about the epidemic of loneliness. This year was about connecting, now that we are at the other tail end, I guess, of the pandemic, like how are people reconnected with one another, especially young people. Especially when we think about AI, when we think about social media. And so really using this youth summit to really engage more young people. These are just, again, some of the numbers. 67 have been trained. We engage a lot of young people in our peer leadership program through our peer-led workshops. A lot of those workshops are also in partnerships with CBOs. We've worked with CBOs like Diaspora Community Services, just to name a few, but again, really engaging young people in their networks and also their community members. When it comes to our community education workshops, again, the barbershops and salons, the faith-based institutions have been really strong partnerships in that, and so in the last 5 years, we have engaged over 2,500 members. And this is just some of the newspaper articles or just the publication about the work in the last 5 years and how the Institute has really, again, met the community where they're at. And so, again, when we first started with UNICEF USA and their support, and then over the last 5 years about some of the work and, again, addressing the needs of young people. And now I've been talking a lot, and so we actually want to hear a little bit from our young people. We have about 4 or 5 of our peer leaders from across the 5 years, and so I will call up Joanna Blake again, Kaisa Wade, Dakota, Yasmel. We could give them a clap, a round of applause. They volunteered to come today. Elijah as well, I believe, is here, and we will hear from them.
Hi, it's me again. My name is Joanna Blake. I go to New Heights Academy Charter School, which is located in Harlem, and I am a 16-year-old junior. I participated in this program 2024, and what I've taken away from the program is how social disparities work. Before entering this program, I didn't have a lot of information about the different locations and how location can affect how you get medical resources. I actually learned from this program that the #1 aspect of determining health resources is your area code, which is crazy. And that showed me how just because of where you live, it limits the amount of resources that you get. And I think that's very important for communities that have very low income neighbors and that are struggling economically. And yeah, and I feel like that program will help me throughout college and my high school years and help me understand my peers better and also help me understand myself better.
Hi, I'm Kaisa Wade. I am a freshman at Hunter College. I started Beyond the Stigma in 2024, but I've been here for about 3 summers. And similar to Joanna, before I started working here, I didn't know a lot about mental health, sexual health, social detriments. I didn't even know public health was like a field to begin with, or other fields like social work, psychiatry, which I'm excited to hear about later. And working here has given me a lot of motivation to do more community outreach, to do more research, to learn more about and talk more about the topics that matter to my peers and the community around us. And that's part of the reason why I'm aspiring to be a public health major. And I'm just thankful for everybody here who I've worked with and spoken to.
Hello, my name is Yasmel Carrasco. I attend Bronx Prep High School. When I first came here, it did not just impact me academically, it impacted me personally, professionally, and emotionally. One of the biggest things I've learned is that change happens when somebody decides to listen. When I first began to come into this program, I had this desire to create a change in my community in the Bronx. Ever since then, with the amount of knowledge and amount of education that I've learned about mental health, it has inspired me to pursue a career in social work. Thank you.
Good morning. My name is Dakota. I'm a senior at the High School for Youth and Community Development at Erasmus, and I'm also a member of the Health Science Academy, so maybe I'll run into some of you on Wednesdays, you never know. But this summer program really helped me to understand how to talk to my peers better. I was always the person that people would go to, when they had a problem and when they needed someone to talk to. And so the program really did increase my vocabulary when it comes to mental health things, but also it helped me better understand how to connect with people and how to help them get through things when they need that help.
Hello, my name is Elijah Antoine, and I go to Eagle Academy for Young Men, Southeast Queens. I attended this program in 2025, so this summer, and it really impacted me by just allowing me to be able to be there for my friends, my families, and needed mental help because, you know, I have a lot of friends and a lot of kids my age go through a lot of things and they don't know who to talk to. They, like Miss Kenya said, they normally go to their friends. So I saw this program as a way to, you know, help my friends, my community. So, you know, I joined it and I had a lot of fun. I would love to do it again. And yeah, thank you.
Thank you all. I hear you all the time about you would like to do it again and can I create other programs for you, but just want to say how proud to hear you guys speak about just the program impact. All of you have grown, so really, really proud of you, and thank you for always volunteering. Can we give them another round of applause? All right. So I'll be around, but also I think really quickly before I leave, this is a collective effort. I know that I have like kind of spearheaded a lot of this in the last 5 years, but the entire Institute staff have been really tremendous in this work, so I just also want to acknowledge that, so thank you. Dr. Frazier.
Thanks again. It was so inspiring just hearing from our young people and all the things that they've learned in such a short time. So we are really proud of them.